Greetings, Chairman Gottfried, Chairman Rivera, and members of the New York State Assembly and Senate Health Committees. Thank you for this opportunity to provide testimony in support of the New York State Health Act.
Excuse me, can you each state your name
Oh,
for the
I'm
record?
going to.
Yep.
That was my next.
Oh, okay.
My name is Patricia Loftman. I'm a certified nurse-midwife and fellow of the American College of Nurse-Midwives. I graduated from Columbia University Graduate School of Nursing with a specialty in midwifery in 1981. I practiced full-scope midwifery, caring for women as a midwife, and former director of midwifery service at Harlem Hospital in New York City for 3 decades. Full-scope midwives provide the full range of women's reproductive health care. This encompasses prenatal, labor and delivery and postpartum care, gynecologic care, which includes contraceptive management, and primary care. I retired from clinical midwifery in 2010. I was a midwife at Harlem Hospital when the community was ravaged with the crack and HIV epidemics beginning in 1984. For 10 years between 1985 and 1995, I, together with another midwife, cared for women whose pregnancies were complicated by drug use and HIV infection in a special clinic designed specifically for them. They should not have had good outcomes, but they did. And what was the reason for that? The women attended clinic weekly, which was a requirement, and adhered to multiple and varied appointments. They were engaged in their healthcare because they were cared by midwives who looked like them, who understood their cultural and linguistic norms and values, with whom they developed a relationship and trusted. They remained engaged in their healthcare, in the healthcare system post-delivery, continuing to adhere to health maintenance activities. Recently, an unprecedented amount of media attention has centered around the crises of Black maternal morbidity and mortality. Today, Black women are 8 times more likely to experience a pregnancy-related death than a white woman in New York City. Approximately half of the causes of these deaths are of medical causation. Yet a study of more than 45,000 women found that only more than half visit their OBGYN. Less than 6% visited a primary care physician. The CDC reported in 2017 that 12.5% of women aged 18 and over reported that they were in fair or good health. Women, however, only 9.5% of women under age 65 are reported to have health insurance coverage. Women can't take control of their health without health insurance. The New York Health Act would expand women's access to health care by eliminating the lack of insurance as a barrier to visiting a primary care provider to engage in health screening, disease prevention, and health promotion activities before they enter pregnancy. Most women enter the healthcare system through pregnancy. However, at the end of that pregnancy, women's continued access to primary health is discontinued when their health insurance coverage ends. Women's health care has historically been neglected by the healthcare system outside of the maternity cycle. The New York Health Act would make women's health, including care for postmenopausal women, who represent a large number of women without health insurance coverage, a priority, and enable women to access primary care providers, including midwives, to maximize their health and well-being going forward, and if desired, enter their next pregnancy healthy, thereby improving their pregnancy outcomes and preventing pregnancy-related deaths and pregnancy-related near deaths. More and more women of color who are the consumers of women's reproductive health care in public hospital systems, where most midwives work, are asking for midwifery care and midwives who look like them. The New York Health Act would expand women's access to midwives. Midwives are experts in holistic health care with vast experience across all birth settings, from home birth and birth center to large tertiary academic medical centers. At a time when abortion services is under threat, midwives were included in the New York State Reproductive Health Act, which codified Roe protections into New York state law. Substantial evidence exists that documents the benefits to all women of midwifery care, and I have included in my statement evidence from journals such as The Lancet, the Cochrane Review, and PLOS1, or the Public Library of Science. In summary, the New York Health Act would increase health equity for women and families, enabling them to address issues of reproductive justice, birth equity, health disparities, maternal and infant morbidity and mortality, and primary care through increased access to midwives at a time when hospitals are closing their maternity services in rural areas and the availability of women's reproductive health care providers are decreasing, and I thank you.